Europe has seen a big splash in rubeola cases in 2017, that the Planet Public Health Organization says is a tragic following a recording low of 5,273 cases in 2016. Cases enlarged 4 persons fold, in more than rather than 20,000 human beings struck and 35 deaths. 15 Europe area countries, consisting the UK, had big outbreaks. Rubeola cases were highest in Romania, Italy, and Ukraine. Human beings shunning vaccine is portion of the issue, say expert. Though study published 20 years ago on a probable connection among the MMR vaccination and autistic has been disgraced, the frighten it created corrupt several human beings' confidence of the vaccination. Rubeola is a very communicable virus disease how can be fatal. The MMR vaccination can hinder it. The WHO says down there include been declines in common usual immunization scope, as so as sequentially low scope amongst several marginalized groups and interruptions in vaccination delivery or underperforming illness observation system. Dr. Zuzana Jacob, of the Someone, told, each new man struck by rubeola in Europe reminds us how unvaccinated family and adults, independently of wherever they dwell, stay at hazard of contagious the illness and propagating it to other who may not be capable to get grafted. The brief term failure cannot retain us of our obligation to be the general how frees our family of these diseases one day and for all. The UK saw 282 cases in 2017, related to the ongoing outburst in Europe. The common hazard of rubeola to the UK people is cheap, but due to continuing rubeola outbreaks in Europe, cases in unimmunized individuals and bounded further distribution can happen. At the end of January 2018, down there were 51 affirmed cases in the Western Midlands. The vaccination is taking into account as 2 doses to really youthful family as portion of the NHS infancy vaccine program. Adults and older family can be grafted at any age if they include not been completely immunized up. To hinder outbreaks, WHO says 95% of the people should be immunized. In the UK, scope was 91.6% amongst youthful family in 2016 to 17. Rubeola symptoms involve a liquid nasal, sneezing and coughing, ulcer, red eyes, a top heat or, following a few days, a scarlet-brown spotty reckless. The major cause over the abrupt growth in rubeola cases is low immunization scope, the WHO says. They say a absence of scope increases the hazard of the viral infection propagating while it is driven in of overseas. But several Europe countries include seen an extremely top growth in rates. Romania is fight its lowest rubeola outburst in many decades. Down there were more than rather than 5,500 cases recent year, partially due to a lack of the vaccination and impoverished health means. It is as well mind how the nation's big Roma people, who frequently dwell in harsh poverty reduction, are at special hazard of compressing and propagating the viral infection. Italy had the other highest quantity of rubeola cases in Europe recent year. In latter year, a friable team of campaigners versus vaccinations, duplicated the against vax motion, has dissuaded Italians of choice into immunizations by quoting imaginary risks. In answer, the by the government controlled how family must be grafted versus 12 overall illnesses up they can register for country-run schools. The law is one of the key issues in the forthcoming March 4th elections and several human beings are inviting for it to be utilized. Ukraine is as well fighting in a rubeola outburst, in nearly 5,000 cases written in 2017. The WHO says countries how are testing dispute are at an enlarged hazard of rubeola due to corrupt public health services and infrastructure facilities.